Okay, we're back with the final section of our preceptor training. The preceptor has many roles to assume during this program. The two most important roles are 1. Paramedic, and 2. That of trainer and evaluator. A preceptor must maintain his or her performance during training. Sometimes these duties are modified because of training requirements, but the preceptor must be cognizant of the fact that he or she is still a paramedic when needed. While a preceptor is functioning as a paramedic, he or she must also train the new student. This is a trying situation and quite stressful at times. Regardless, it must be done. The most obvious function of the preceptor is that of teacher. The teaching role may, in most instances, occur in the field under actual conditions. There may be other times when teaching occurs over a cup of coffee or during casual conversation. Teaching may also occur in a formal classroom-like environment using lesson plans and audiovisual aids. The fact is, the preceptor will spend much of his or her time teaching even when it does not appear to be an obvious activity. The preceptor is, for many new students, a role model or even a mentor. The preceptor often acts as a supervisor. The intern will make mistakes, and these mistakes are to be addressed and corrected during the training process. There are times when the intern will do something that is viewed as minor in nature, but due to his or her position and the need for behavior modification, the preceptor must take action and counsel the intern. The counseling may need to be followed up by a clinical coordinator or even the agency's supervisor or manager in extreme cases. Depending on the severity and the timeliness of the incident, it is essential that the preceptor take immediate action so that the mistakes results in a learning experience and not a new bad habit. The preceptor in the role of teacher is also an evaluator. He or she must develop and use skills to determine if learning is occurring and whether or not remedial training is necessary. Evaluation skills are of prime importance to this program. If the preceptor cannot evaluate, then he or she cannot train. Evaluation is accomplished by the use of standardized guidelines, phase evaluations, and remedial training, evaluation sessions, and plain old-fashioned verbal feedback. The principal element of effective evaluation is objectivity. The principal goal of evaluation is documentation of behaviors. The preceptor will often be placed in a situation where he or she becomes the problem-solving resource for the intern. Normally, the best way to accomplish this is through counseling. The preceptor must develop the skills to help the intern solve his or her own problems. By allowing them to talk it out and by gently guiding them through their crisis, many of the intern's problems can be solved. Empathy in the preceptor is imperative. The preceptor must be a positive role model for the new students. This is done by maintaining a professional demeanor and appearance when on duty, and especially when on a call. This also means adhering to the standard operating procedures. But perhaps most importantly, it means having a positive attitude about the program and about Harrison County Hospital paramedic program in general. The preceptor's recommendations to the program director and medical director are a very important aspect to the intern completing the program successfully. Because of the documentation and communication with the program director is very important. If the preceptor believes, for example, that an intern should be dismissed, but fails to first document the behaviors in question, then does not attempt to remediate and further document the questionable behaviors, then the possibility is that the intern will not be dismissed. Perhaps even more telling, every intern walks away from his or her initial field training with the label of the preceptor that trained him or her. Therefore, poor follow-through reflects poorly not only upon the intern, but upon the preceptor as well. It would be impossible to list every conceivable aspect of the preceptor's role in this training program or in the preceptor manual. They sometimes change as frequently as every week. Preceptors must be flexible and be able to change as the challenges mandate. Otherwise, the program suffers as well as our interns. A weak preceptor can disrupt the entire training process. A great deal of trust and responsibility go with this assignment, and each student of the program must be willing to accept it. It is vital that the preceptor keep the intern informed throughout the rating period on what is expected and how well they are performing. This is usually done through the use of verbal feedback. Documentation is the written tool for this process. Preceptors are constantly making judgments about probationary interns. However, it is recognized that some of those judgments may be erroneous. This may result because the preceptor made a snap judgment based upon only one performance, or a personality conflict with the intern, or the assumption is made that this intern, like all other interns, knows very little about EMS, or that the preceptor receives false information from another well-meaning but misguided student. Because of these erroneous judgments, some formal procedure or method is necessary to minimize the possibility of bias and discrimination as well as uninformed judgments. Documentation is an objective way to look at performance. It should not be viewed as a negative process or as keeping a book on the intern. Rather, it should be considered as a positive technique to support and sustain performance appraisals, leading to performance-based personnel retention, remediation, or dismissal decisions. It is necessary that the preceptor know what should be documented. Only those behaviors which are observable, measurable, and job-related should be noted. For documentation to be legally defensible, an evaluator must show specific actions. Hearsay or an opinion about an attitude cannot be defended in either a court of law or the court of public opinion. The preceptor should remember that if an action is properly documented, then mention of it dares criticism. The rules are simple. If you didn't write it down, it didn't happen. Remember that documentation can be positive as well as negative. Documentation can serve many functions. 1. It can provide recognition of a job well done. 2. Prevents denial later by the intern. 3. Aids the preceptor memory of events. And it can minimize misunderstandings through remedial training. Documentation can also stimulate the intern's thoughtfulness. It can provide emphasis of critical teaching points. And over the course of time, the cumulative results show patterns of results. Finally, documentation speaks in your absence if you're promoted, transferred, or otherwise unable to complete the training. It supports observations of the intern for future supervisors who may have similar thoughts about an intern's behavior. Person-oriented appraisal methods suffer from numerous shortcomings and inevitably result in rating errors. Despite these facts, person-oriented appraisals are still the most widely applied approach. Some of the most common errors of this appraisal approach are as follows. The error of leniency occurs when the evaluator marks most of the reports in the highest categories, resulting in an overrating of the intern. The error of personal bias occurs when the evaluator allows personal feelings about an intern to affect the intern's ratings. Likes and dislikes tend to limit appraisal objectivity. The error of central tendency occurs when the evaluator places all interns somewhere near the center of the rating scale, or when they routinely bunch rating scores near the center. This occurs because the rater may not be aware of how the rating is to be used, or subordinates are not well known, or because justification is required in extreme ratings. The error of related traits occurs when the rater gives the same rating to traits that are considered to be related in some manner. The value of each rating is lost, and the overall rating is less valid. The halo effect occurs when the rater lets one or two traits, particularly those that the rater admires, dominate the appraisal of the intern. The rater evaluates all remaining traits based on the dominant trait or traits. Halo effect may also occur when the rater is influenced in a particular category by one outstanding event which occurred in that category. In the course of education, every instructor meets the student whose performance is not acceptable or up to standards. With the student's best interest in mind, the instructor is obligated to commence a process of correction and remediation. The first step in that process is the contact report. A contact report is documentation of the problem behaviors as well as a written plan of remediation to correct those behaviors. Typically, a contact report is written after an instructor sits down with the student and reviews the situation and discusses the problem and the instructor's expectations. The contact report should contain a number of elements. The instructor should begin with a description of the performance problem. This description should be tied to a written standard or other supporting documentation. If the misconduct involves a breach of ethics, for example, then the corporate mission statement or the code of ethics can be cross-referenced. It is important to include any previous statements that have been made to the student regarding the student's lack of progress with expected performance or misconduct, and specifically if any verbal warnings were issued. These statements and warnings must be referenced in the contact report, as failure to do so may not permit the instructor to raise these points later. The student needs to know how his failure to perform or misconduct has affected the organization in a negative manner, and that these impacts, intended or unintended, are not acceptable. This statement should clearly place the conduct or performance as unacceptable. With that said, the instructor would then proceed to outline what changes in the student's behaviors or performance are expected, and how the student can facilitate those changes. These changes should have time limits. Requirements without deadlines are a plan for a disaster from a disciplinary perspective. Every student, old, new, or probationary, has the right to a fair hearing, and a right to face his or her accuser, and a right to defend their actions or decisions. Therefore, and according to the guidelines for discipline established by the Harrison County Hospital Paramedic Program, an intern must be treated fairly. This includes the privilege of reviewing any evaluations that are written about him or her. In point of fact, every training evaluation has 2 sign-offs, one for the preceptor and one for the intern. As mentioned earlier, the preceptor has a variety of roles. One of those roles is as a teacher. Some of you may have had formal training in how cognitive and psychomotor learning takes place. Preceptors interested in transmitting skills and knowledge to others must answer 3 important questions. What should be taught? What material and procedures will work best to teach what I wish the intern to learn? How will I feel when I have taught effectively? Not only must the questions be answered to instruct effectively, they must also be answered in the order that they are listed. Instructional methods that enable the intern to progress more rapidly toward the training program's objectives should be used. Moreover, procedures to evaluate the intern's progress towards the objectives should be implemented as the situation dictates. First, the objectives of every session, as well as the overall program objectives, must be communicated to the intern in the beginning. He or she must understand these objectives, recognizing that a clearly stated objective succeeds in communicating to the intern a visual conception of a successful intern's skills at the end of the instructional period. Learning objectives are only fully realized and therefore meaningful when the intern can demonstrate competence. A statement of specific objectives is not sufficiently explicit unless it indicates how the preceptor intends to sample the intern's understanding. The preceptor must determine what the intern will be asked to do, demonstrate his or her understanding. Specifying the minimum acceptable level of ability for each objective creates the performance standard against which instructional programs can be assessed. It can then be readily ascertained whether or not a program of instruction has been successful in achieving the instructional intent, be it creating a minimally competent squad student, as this program is trying to accomplish, or any other purpose. One of the most successful ways to indicate a lower limit of acceptable performance is to specify a time limit for completion of a skill or activity. For example, the evaluation of the trauma patient is directly contingent upon completion of all life-saving procedures within a specified period of time, for example 10 minutes. Time limits often are imposed upon interns more informally when they are told how much time they will be allowed to complete a report. However, time limits and minimum numerical scores are not necessarily essential. What is essential is that there are reliable, accurate methods to measure intern performance according to the stated course objective. Research has shown that active and participating students learn more effectively than non-participating students. For example, you retain 10% of what you hear, 20% of what you see, 30% of what you see and hear, and 60% of what you do. The more the intern participates in an incident, the better he or she becomes in handling its demands, providing, of course, that his or her responses are accompanied by effective critiques. If the participation is to be effective, interns should acquire basic knowledge prior to the field training sessions. Videotapes, readings from textbooks, and the like may assist the intern in the acquisition of this foundation. Because individuals learn at different speeds, standardized programs can hold some students back while others move ahead. Self-paced individualized programs of instruction are a method of overcoming the learning rate problem. The individualized instructional technique must be goal-oriented. There must be a clear definition of what the intern will be able to do after the session and after the program. Your willingness to be a preceptor is greatly appreciated. If you have any questions or comments about our paramedic program or the students, don't hesitate to contact Mike Hunter at 812-734-3818 or the email listed on the screen. Now proceed to take the short quiz for the preceptor training program. And again, thank you.